part of the treaty lands and territory of the Mississaugas of the Credit First Nation, and we recognize the traditional territory of the Huron-Wendat and Haudenosaunee people, and we acknowledge the First Nations, Inuit, and Métis people whose lands we live on today. For the sake of the recording, I completely forgot to record the introduction, but welcome to the Global Health Annual Review's career panel. And we are going to dive into, first of all, thanking our amazing panelists for showing up today. I know it's a busy Monday, and Mondays can be a bit of a drag, but hopefully this event really livens everyone's evenings up. And so we would like to start off with the first slide, and we ask our panelists to kind of introduce themselves and tell us a little bit about what they do and the fields that they come from. So if we can go on to the next slide. Oh, thank you. I'm just going to welcome Toby.
Hi, everyone. Such a pleasure. Thanks, Jenny. Thanks, Chloe. Thanks, Maya, for inviting me to be here. So yeah, my name is Toby Lee. My pronouns are he and him. I have two roles, really, that are exciting to me. The number one role is I'm currently a PhD student at the University of Manitoba. I currently work with a population from Nairobi, Kenya, particularly sex workers. In collaboration with this community, I've been myself and my lab have been researching this community for a really long time now, trying to understand HIV immunology. So that is kind of like my day job. And then, when I'm not being a PhD student, I'm also the Canadian Youth Delegate. And as part of that role for me, I was appointed by the Government of Canada to essentially represent Canadian youth at the World Health Assembly. And essentially throughout the year, what I do is I facilitate these roundtable discussions with young Canadians and to discuss on different global health priorities and, what are their concerns. And after the sessions, what we do, myself and my team, we essentially create a policy recommendation that we later submit to the Government of Canada to inform their interventions, as well as to present them at the World Health Assembly, which I just recently came home from, and we'd love to share more about that. Thanks, Jimmy.
All right, thank you so much, Toby, for sharing about your role. Next, we asked Dr. Sim if he'd be open to sharing a little bit about yourself and the work.
Of course. Hi, everybody. My name is Amanda Sim. I'm an assistant professor at McMaster University in the Department of Psychiatry and Behavioral Neurosciences. And I'm also core faculty with the Global Health graduate programs at McMaster. Very pleased to be with all of you tonight. Thanks for inviting me, and also really excited to hear from the other panelists. So as it says on the slide, I did my PhD at the University of Oxford. I'm currently also a core member of something called the Global Parenting Initiative, which is a 5-year consortium led out of the University of Oxford to scale up parenting and psychosocial support to families living in the Global South. The International Rescue Committee, which is the other logo you see there, is actually a previous affiliation. I worked with the IRC for many years prior to my PhD. It is a large humanitarian organization working in 40 countries around the world. And that was really, I would say, my most formative experience in terms of global health and research and evaluation in the Global South. So I was implementing as well as evaluating mental health and violence prevention interventions in countries such as Afghanistan, Liberia, Lebanon, Thailand, Ethiopia, and so on. So I'm happy to talk more about that as well. Thank you.
All right, thank you so much, Dr. Sim. We have our next speaker, Prativa.
Hi, everyone. Really lovely to be here. Thank you for the invite and really excited for the discussion this evening. I'm Prativa. I'm an epidemiologist. I trained at Columbia for my infectious disease epi degree pre-COVID, so before epidemiology was famous. I'm currently finalizing my PhD at Hopkins in health systems and international health, and I have my hands full in a couple of different hats, as you can see with the logos below. I'm the co-founder of Let Science Connect, which is a little firm that helps academics communicate their science better. I did a lot of science communications during the pandemic, a lot of media, and I realized that this was a gap that a lot of people in our field needed needed support in. And so that's what I'm currently doing. I also serve as a global health consultant for a number of international organizations and foundations. Right this second, I'm working for the World Bank, supporting countries in their strategies to strengthen health systems, pandemic preparedness plans, looking at One Health approaches to all of this, and just monitoring how COVID affected their health systems over the past several years. One project that I'm really excited about that I just wrapped up was with the WHO, where we were looking at monitoring and measuring upstream risk drivers. So things like equity, things like climate change. So how do we measure them and monitor them? Because obviously these upstream risk drivers play a large role in our ability to be prepared for health emergencies. And then one additional thing that I'll say about me was that I'm also consulting for the Canadian COVID Task Force right here in Canada, and a project that I'm currently working on and that I'm driving for them is a pan-Canadian surveillance system that can catch threats early so that we're not, constantly stuck in this panic neglect cycle that we had to deal with COVID. So that's a little bit about me, and yeah, really excited for this discussion this evening.
Great, thank you so much. Chloe, if we can go to the next slide, we're going to introduce Dr. Alenko.
Hello there. Thanks again for the invite. I'm just going to give a little bit of a background, maybe slightly atypical from what we've heard before. I never really knew what I wanted to do in life. So I started out my career in academia, majoring in physics. I hated my first year physics teacher, and I thought I can't do this for 4 years. So I switched over to economics. Then I did a master's in physiology, and then I wanted to do a PhD in health policy. So that's a bit of an atypical pathway, but what it does mean for me is that I have a very broad perspective on the issues, and a lot of that work for me is in health economics. But the work I'm doing now, a lot of it is looking at cancer patients and the impact of a cancer diagnosis financially to them, lost time from work, out-of-pocket costs, decisions to forego care, those sorts of things. I just finished a national study looking across Canada at about 900 patients. Some of that's been published, some of it is, I'm just about to enter a sabbatical, so I got to finish writing the other 5 or 6 papers that came out of that. It was a pretty rich data set based on a questionnaire that I developed. And the other work that I do is with the government, both at the provincial level, at the federal level. I sit on an organization called PERC, which stands for the Pan-Canadian Oncology Drug Review Expert Review Committee. I know that's not the right number of letters, but we decided the P was all the first part, and the ERK is the Expert Review Committee. I've been doing that work for about 8 years, and we basically make recommendations to the federal, well, really to the provincial governments, but it's done at the federal level, on whether or not new technology should be funded or not. So that's been interesting. In terms of my connection with global health, I'd say probably of all the projects, and I've been involved in a lot of projects over the years, I was involved with the Ministry of Health Promotion when we had an Ontario Ministry of Health Promotion on evidence to guide action, which was a tobacco control strategy. So that was a 5-year strategy, and I was responsible for the economic piece of that. Because as you can imagine, there are costs associated with smoking in terms of the healthcare system. So I guess I'll stop there and leave some room for the last speaker.
Thank you so much for sharing that. And lastly, we have our last amazing panelist, Bree.
Hi, everyone. Thank you so much for having me. It's so nice to see a lot of familiar faces, both in the panel and in the audience today. Yeah, so I guess I'll start off with my background too. I actually began my academic journey here at McMaster. So I always love attending McMaster events because I still feel like it's kind of my home. But I did my master's degree at Western University in global health, and then followed that with my PhD, which is also at Western University. So I'm a current PhD candidate. I just finished up my candidacy exams, so I'm about at the halfway mark. I'm in the Health Information Science program, and my dissertation focuses on the use of innovative technologies, specifically medical delivery drones, as a way to improve health accessibility in really remote or hard to reach communities. I was the 2022 Canadian Youth Delegate, which is the role that Toby is in right now, which was a really great experience and really kicked off, I think, my career path to where I am now. I was hired after finishing my term as the Canadian Youth Delegate by the Public Health Agency of Canada as a policy analyst on the WHO team there. So we just wrapped up a really chaotic week with the World Health Assembly last week. So it's going to be nice to have some off time, I think. But also at PHAC, I run the National Youth Engagement Strategies for the Office of International Affairs and for the Public Health Agency of Canada, alongside the policy analyst work that I do there as well. And then on top of that, I've worked as a research consultant at several drone companies who are running projects in Northern Canada for the use of medical delivery drones, which has been really great. I'm really excited about a project I'm working on right now with a community in Northern Ontario, kind of assessing the feasibility of using drones for emergency delivery and emergency response. But yeah, that's basically my background. I've kind of hopped around between government, NGOs, and research. So hopefully I can help provide some insight to everyone today.
Amazing. Thank you so much for sharing, Ray. We did have some questions for you all, but it seems like a lot of you have touched upon a bit of the first question, so we're going to tweak it a tiny bit. And for all our panelists, we are curious, what are some defining moments in your career path that led to your current position or your current work?
Jenny, do you just want us to hop on and just chat? Okay.
Anyone who's ready. I know sometimes it takes a few minutes. We want to think and gather our thoughts.
I can get started just very, very briefly. I will have to say that this might be a bit of an odd answer because I was an epidemiologist when COVID first happened. I really have to say that that was probably one of the most significant shocks, I guess, in my career, in the sense that when the pandemic first happened 3 years ago, I just felt like I needed to do something. I had the skills for it. I'd been trained for it. And so one thing that I did, and hopefully this will be helpful to a lot of you listening in today, I just cold emailed everybody that I could think of who was working in the COVID space and saying, okay, how can I help? How can I support you? What can I do? And I think just that initial email to a lot of Canadian folks, actually, I got a lot of responses back, and I was able to be involved in a lot of projects early on when I felt like the whole world was shut down and I wanted to do something to support a lot of the global and the Canadian specific responses. And so I think that would be probably the most meaningful jump in my career trajectory, was just utilizing this massive shock that was happening around the world and saying, okay, how can I contribute to this? And finding some really, really key mentors who are willing to give me grace and give me the space to be able to learn and to support these various initiatives. So I'll stop there.
I think that's actually really, really interesting to hear, because I think a lot has changed in the world during the pandemic. So thank you so much for sharing. I see Dr. Sim, you have unmuted.
Yes, I can jump in. Like Dr. Longo, I have had a non-traditional path to where I am now. And I do think it's useful to hear a little bit about the path, because I think often with young people or fresh graduates or people entering the workforce, they have this message that they need to have it all figured out. And I tell my story as an example of how I did not, and I still do not have it all figured out. And students who have been in my class have heard me give this spiel, so forgive me if I repeat myself. But I was not one of those people who knew from the beginning I wanted to be an academic. I still don't know if I want to be an academic, but I do know what I'm passionate about. So I did my undergraduate degree in psychology and Romance languages, of all things, because I was interested in how people feel, why they behave the way they do, and I was interested in other countries. So in my mind, the two majors made sense. After my undergraduate graduate degree, I wanted to get work experience. I didn't want to just go straight on to collecting more degrees. I wanted to be in the trenches and get some real experience. And so I joined my first job out of college was with a local foundation in New York City called the Robin Hood Foundation. And they fund nonprofit agencies in New York to fight poverty. Through that job, and this is a defining moment, I got to know a really cool organization at the NYU Bellevue Hospital called the Program for Survivors of Torture. They work with refugees in New York City who, as the name implies, had experienced torture and were suffering physical and mental health impacts of that. So through that experience working with that organization, I decided to do a master's degree at Tufts University, focusing on international humanitarian assistance. And again, after that degree, really felt like I wanted to get real life experience. I felt like I didn't want to just kind of sit behind a desk and write about things that I hadn't experienced myself. And I was very interested in war, displacement, refugees. So my first job after my graduate degree was to go to Afghanistan and work for a research institute there, which was an amazing experience, then moved on into implementation. So I worked with the IRC. And at the time, evidence research, these were not buzzwords in the humanitarian sector the way that they are now. So this was a while ago, 15 years ago, to date myself. And we were still just implementing programs with no idea whether or not they worked. And so I was really fortunate to be part of a movement at IRC to really bring evidence into the forefront of what we do in humanitarian sector. So that was another defining moment in my career where I got to basically learn how to do field experiments or randomized controlled trials in a global health setting. And that's what led me to do my PhD, looking at mental health and parenting interventions, which is what I still do today. But if you had asked me, 20 years ago, is this what you wanted to do? I didn't even know that this field existed. It was really just a matter of just going for different experiences, being open to lots of different experiences. And that's what has led me here today, doing really interesting work that I'm passionate about. And so I would say to all students who, if you're here, you are driven type A personalities who feel like you need to have it all figured out. And I'm here to tell you that you don't. It's going to be okay. So that's my spiel.
I'd like to follow on to that because I think a lot of what you said, Amanda, really resonates with me as well. I talked a little bit about my background, but I grew up in sort of a lower middle class environment. And so most of my education had breaks between it because I had to go and earn more money because I had to pay for it myself. So I did my undergrad, I worked for a couple of years. I did my master's, I worked for 5 years. I did my PhD. I didn't finish my PhD till I was in my 40s. So, but I still had enough time to have another career. So the one thing I think from that I want to say, it's an important lesson for me, is you don't have to be defined by your age. A lot of people seem to think, by the time I'm 25, I should be doing this, or by the time I'm 30, I should be doing that. And I think historically, maybe that was true, but I think today in our environment, that's really not true anymore. And I think the notion that once you choose a path, that's your path, I think is a very inaccurate one today, especially because employers don't see their employees that way anymore. So I think as the environment changes, I think we need to recognize that we can be passionate about what we're passionate about, like Amanda said, but that doesn't mean we're always going to be in the gold watch for 50 years of service is gone, right? That used to be true 30, 40 years ago, even before I started working, but that model is essentially gone. The only exception to that would be if you're an entrepreneur and you have your own business and you grow it. But I really do think that, there's a great book I read by Steve Poland called Die Broke. I won't go into great details about it, but he talks about building your career. And he says that what you really need to do at any point in time is quit today, but don't retire. In other words, you need to have your resume at the ready because you don't know what your next job is going to be. And I really like that notion because, Amanda's example is a great one. She did a lot of different things and they're all building towards some other goal downstream. She might not know what that goal is, but eventually it's going to appear for her. And I really think that's true, particularly for this generation of students. I think that is the attitude that you need to have. And, for me, I finished my PhD in my 40s. A lot of people would have been settling into their career. I thought, nope, I'm going to do something different now. I spent 16 years working in pharma, and that was okay, but it seemed too one-dimensional for me. And I don't think one-dimensionally. So I found the job too limiting, and I found academia gave me more freedom to do lots of different things. And I have done lots of different things in mental health, in cancer, in diabetes, in economics, in policy. So, that's allowed me that freedom. For someone who's not a linear thinker, but more a lateral thinker, it's a wonderful environment to work in. And of course, as I'm sure you can appreciate, you get to meet a lot of other like-minded researchers who you end up collaborating with, which is also something most of us enjoy doing. So that's probably more than one message or key message, but I guess I'll stop there.
Thank you so much for sharing. Toby, I also see you unmuted.
Yeah, and you know what? I think I'll share a bit about my experience. So I did my undergrad at Western University, and I did it in medical science. And first year of medical science, my goal was I want to help people. I want to help people, and I want to make a difference, and I want to leave a legacy. So the popular idea that comes to mind is I'm going to be a doctor. I'm going to do really well and throughout 4 years, and I'm going to do my MCAT in my second year, get into lab, whatever, and become a doctor and save lives, make a difference. So first year comes by, and that year was great. And then second year comes by, it's time now to do, some lab work, get into the lab, do your MCAT that year. And, coincidentally that year, I received an offer from, an organization I was affiliated with at the time called Western Diseases. It's a nonprofit organization at the Western University that is, that essentially what they do is that they bring students and researchers from the university over to East Africa, particularly Tanzania and Kenya. And essentially bringing trainers over, what happens is that, they educate or train local women on how to produce probiotic yogurt or fermented foods. And essentially, this project has been running for over 40 years on the premise of a probiotic strain that a researcher had discovered, 30 years ago. And because bacteria grow really fast, the premise is really interesting, is that, with a sachet of this particular probiotic, local women can produce over 100 liters of probiotic yogurt. And based on the research that the group have done in the past, this probiotic yogurt can promote gastrointestinal health, vaginal health, and so forth. But at the same token, you could also see the financial empowerment there, where these women can produce yogurt to, not just feed people for better health, promote better health, but also sustain themselves. So I didn't know that at the time. All I received through an email was an offer for a scholarship. It was at the time $4,000 to do an internship in East Africa and to do it on yogurt. And at that time, I had two offers: one to do a lab internship and get my head into the whole MCAT sphere and become a doctor and save the world, leave something. The other is to go to East Africa and do this probiotic internship that I don't really understand about, work with women that I don't know who they are. So it took me 4 weeks to contemplate, and I kept asking everyone, what should I do? So, on the last day when my offer was going to expire, I said to myself, I'm going to flip a coin. I'm going to flip a coin. If it's heads, I'm going to head over to East Africa and do this internship, and it was heads. And the internship was 3 months, and I was the only intern there. There was no other Canadian intern, and that's why I guess the scholarship came so easily. So I was the only intern there. And I would tell you right now, that was the best 3 months of my life. During those 3 months, I got to work with local women, these East African women, who come from very impoverished circumstances, many of which were, living with HIV or widows, or, taking care, of large families by themselves. And the privilege to be able to work with them, taking research, and transforming it into a way that empowers them, as well as gives them some self-agency, giving them almost a mission to promote health for the community, but at the same time to give them a resource to financially empower themselves. That experience was so rewarding to me And through the 3 months of work that we did, we met with the UN, we met with the World Food Program. We developed over 60 different kitchens from those 3 months, where we empowered other women across the country to be able to open their own, social enterprises producing probiotic yogurt. So after that internship, it really revolutionized my understanding of what it means to help people, what it means to create a legacy, what it means to make an impact. And, after that, I would say that was the most defining moment of my career, because since then, my understanding of the way that I can impact society or help others people is not per se through medicine, but through what I believe are my strengths, which is, applying research, applying science communication, and working with communities. And when I meet, with undergraduate students, and, everyone's ambitious, and that's great. But the biggest advice I always give to students is, medicine is a great way to make a difference. But, you're still young, and we're all still young. It's really imperative that you take risks to explore, because you never know, your strengths, might be not in medicine, but somewhere, some other sector that you would not expect. Thanks, Jenny.
No, thank you so much for sharing that. That's actually a really, really interesting story. I'm glad you got to share that today. Do we have any other panelists who would like to contribute to this prompt?
Yeah. I'll be really quick, because I think I'm just going to be reiterating a lot of what the other panelists have already said on this topic. But I also had a very non-linear progression through my education and into my career field as well. If you'd told me 8 years ago when I was starting undergrad that I was going to be a PhD student working in international health policy, I would have told you, no, I'm going to be an archaeologist, because that's what I thought I was going to be 8 years ago. So I think kind of the synopsis of what we've all been saying here is that there is no such thing as a perfect linear way to find your career. And you can plan and plan and plan as much as you want. And I did. But things will probably end up really different from how you're picturing it now, and that's okay, and that's just how life goes. So yeah, I won't go on anymore, but I think we all kind of have a similar background when it comes to this question.
If I could just interject one other comment. I think, we all have a dozen good lives that could be our paths. I don't think there's a better or worse one. And I think when I talk to students, a lot of them stress about, oh my God, if I don't get this job, well, my life will be a disaster. And it's like, that's just not true. There are so many different paths for all of us. The skill sets that each of us have can be applied in many different careers. And so it could be academia, it could be government, it could be private sector. It doesn't really matter, as long as it, again, back to Amanda's point, as long as you're passionate about what you do, then there's lots of places you can apply that passion.
Yeah, absolutely, for sure. Thank you all so much for sharing that. I think I overestimated how many questions we can ask, because there's just so many interesting stories from everyone to share. But I will give the audience a bit of a chance for our live audience here today. If you have any questions you want to ask to either the whole panel or any specific panelists, please feel free to unmute, raise your hand, or shoot the question in the chat if you prefer that avenue. We are going to be monitoring the chat. I see we do have one hand raised, so please do share your questions however you feel comfortable.
Yeah, hi everyone. Thank you so much again for organizing this career panel to you guys. And again, thank you so much for your expertise as well to all the panelists. So I have one quick question regarding, I see every panelist, you have a PhD. So I don't know, again, would a PhD is required for pursuing a career in global health, or is a terminal degree required, or experiences with public health agencies can compensate with that?
I'm going to try throwing a comment out on this. There's been a trend lately with students not doing PhDs and doing several master's degrees. I've seen some very, very bright students who I was convinced should be in a PhD program. And a lot of them have said to me, those ones who are bright and knowledgeable and decide to do several master's levels degrees, is I think these are more applied. I think the PhD is more theoretical. So if I'm going to be an academic, sure, I need a PhD. But if I'm going to go work out in the field, and one of these students I'm thinking about specifically, like I said, who was very bright, she had already worked in 20 countries when she came to do her second master's degree. But her idea was, I want hands-on skills I can use out in the field. And for me, that's a series of master's degrees rather than a PhD. So part of it, I think, has to do with where you want to go or where you think you want to go. And I think the world's changing. And, that notion that you have to have a PhD to get certain jobs is still true, but there's lots of jobs where several master's levels degree may be just as valuable as a PhD.
Thank you so much, Dr. Krishnan.
Oh, sorry. I would even go further to say that I would think in the majority of global health careers, you don't require a PhD. I think a PhD is required for very specific roles. For example, academia, for sure. I think research, I know a lot of amazing researchers who don't have a PhD, who have a master's. So I don't even think you need a PhD to do really good research. So I would think very carefully about the reason for doing a PhD and the kind of job you would want to get with that PhD, and really question if you really need one to do the kind of work you want to do.
Thank you both so much for sharing that. Absolutely. I think that is an interesting question that we didn't even notice, that all our panelists either have a PhD or a candidate currently. Do we have another question either in the chat, or if anyone wants to speak directly with our panelists, we also heavily invite you to do so. In the meantime, we did have some questions from the previous list that unfortunately we didn't have time for all of it, but we are curious. What advice would you give to individuals who are passionate about making a difference in global health or public health, but are unsure of where to start?
I can maybe start with this one. I was kind of thinking before this panel what advice I might give someone who is maybe like me 2 years ago, right? So I think the biggest thing that I've learned over the last few years is to accept rejection, as oxymoronical as that sounds, but I think there tends to be an assumption in this space, in academia and research especially, that people who have found success have done so in that perfect linear path kind of that we were talking about. And I can say, at least from my experience, that this definitely wasn't the case. I've received far more rejections in my career than I have acceptances, and that definitely used to affect me a lot. And when you're passionate about global health, as I'm sure most of the people here today are, facing rejection can be really hard because it feels like you're being impeded from making a difference. I know I'm hardworking and motivated, and I don't want to sound like I'm labeling success as chance by any means, because it definitely is much more than chance or luck. But sometimes all it takes is that one spark to really set you off on your career path. And my spark, I'd say, was getting the youth delegate position back in late fall of 2021. Something that while I was applying for it, I considered myself extremely underqualified for, and I really did not think I was going to get it. But I applied anyway because I knew if there was even a chance of getting this position that would enable me to do something I'm so passionate about, I had to try. And I did. I got it, and it was amazing. But that was really the first domino that sent everything else in motion since then. So I guess what I'm trying to say is that every person who has found a career that they love in this field probably faced a plethora of rejections before they got to where they are. And that's normal. And it's not a reflection of who we are or what we're capable of. But if you can just keep pushing forward, keep applying for opportunities you're passionate about, even if you're afraid you'll be rejected, one day you won't be, and you'll find that spark and things will kind of go off as a domino effect like they did for me. So I think that's the biggest piece of advice I can give to especially students or young professionals who are just getting started in finding their global health career path. Yeah.
And if I can follow on to that comment, I see we have a student with a question, but I think the notion of failure has been stigmatized in our society. And I think that's really, really unfortunate because firstly, the more you fail, you actually start to understand the process of failure. And so the first thing with failure you want to do is figure out what were the elements that went wrong? How can you make it better next time? And also creativity is surrounded by failure. If you want to be creative, you have to be prepared to be wrong, maybe 80 or 90% of the time, but the one time you're right or the two times that you're right are going to be amazing. And so there's some really great TED Talks on this, by the way, but if you're willing to be wrong, if you're willing to take a chance, if you're willing to take that gamble, the rewards can be outstanding, just like it was for Bree. But people who want to be safe are the ones who don't have those opportunities. So I really want to encourage students, it's okay to fail. It's not okay to look at that failure and not look at it closely and understand why you failed and what you can do differently. So don't become a victim of that failure. Look at it as an opportunity to be better.
Absolutely. I think that's so important to hear, especially for people who are starting their careers and just finishing off whatever degrees that they are pursuing at the moment. I noticed we had someone unmute, Prativa.
Yeah, I just wanted to add to what was said. We'll just keep it really short. But the concept of failure as well is something that all of us think about. But I think the other piece to really remember is because you failed, you're able to create your own path. And I really want all of you to think about that. We've spoken a lot this evening about nonlinear pathways and how all of us have those nonlinear pathways. And oftentimes it's because we've applied, but other times it's because we've failed and we've been forced to take a different pathway. And that's totally okay. And in fact, it opens up more doors than you would have otherwise anticipated. And so I think what Dr. Long said earlier about taking your failures and investigating it, figuring out what went right, what went wrong, but then using that as fuel to kind of carve your own niche and your own path is super important. And to add to that, I think sometimes it's really hard to do that on your own. And it's really nice to see communities like this emerge because it means you have tons of individuals behind you ready to support you and help you and open doors for you. And don't be afraid of utilizing that and leveraging that. Like, find your people. Some of the best work that I've done in global health has been because I had incredible mentors and incredible colleagues who brought me on and opened the doors for me so that I was able to lead an initiative or the other. And all it takes is that one domino, as Bree said, and then everything else will kind of set in stone. And so really use the failures to create your own path and find your mentors and find your people to help your career, because at the end of the day, your community is able to do so much. And the final thing I'll say is think about the kind of like transmission chains, except in a more positive way. Think about the people that you would want to connect with. I promise you there is someone in your immediate vicinity that can connect you to those individuals. The world is a lot smaller than we think, particularly in the world of global health. And so really seeing who are the people around you, who's doing the type of work that you would like to do, and finding ways to connect with them could be a really great way to think about not just where you want to be, but all of the other opportunities that exist that you haven't even thought about. And I'll leave it there for now.
Noticed we had, thank you so much, first of all, for sharing. I think a lot of this, even I really need to hear this and be reminded of the concept of like growth and having a growth mindset. I noticed we had a hand raised to ask a question.
Thank you, Jenny. I just wanted to share an insight. It's not a question. I think for me, what resonated is how did I start is I looked around the community and then listed all the challenges, like what are the challenges that I'm passionate to address. And that gave me like enough clarity where to start. Like, I'm from Afghanistan, and I realized that we lacked research capacity in Afghanistan. for me, that was a great opportunity to contribute to research. And I started during the pandemic. I started learning the skill set that will help me to, become an established researcher and then, collaborate with other international researchers. That helped me to get admission at McMaster and also receive a PhD offer at the University of Southampton. And then I started, I decided to start a master's at McMaster University because I also wanted to get some hands-on experience as well. So I think it's, we have to, keep it as simple as possible. Just look around, just observe as much as you can. List all the challenges, see how can you address them. And then I think that can be a great start, to build your career. So it's always going to be confusing, and then also reach out to people like, I'm passionate about this and I don't know where to start. There are thousands of people that would help you. So I think that for me that worked, and I'm still like exploring, what should I do after my graduation? Should I, start a PhD, or should I, get some work experience and work in an organization? I've kept my option broad. So even if I start PhD, that still works for me. If I go to the, work experience, that was just something fulfilling for me. So I'm open to both of them. So that's something that I wanted to share. Hopefully that will resonate with lots of students.
Thank you so much, Yasser, for sharing.
Yeah, I'll just pop in real quick. There's a question in the chat from Sydney. This is for Bree, but I think Toby could also maybe hop in and answer too. It was, how did you get experience to get the youth delegate position? And was that a year-long opportunity? Also, how did you connect with the World Health Organization and the Public Health Agency of Canada and work your way up to your current role?
Yeah, thanks for the question, Sydney. And yeah, Toby, I'm sure can definitely jump in on this one too. So I guess for the first part, how I got the experience. So I actually I received an email, a promotional email about it through my global health master's program. And it was very much like a job application. So that application comes out every fall. So keep your eyes out. I think be in touch with Toby too, if you're really interested in that opportunity. And it is a year-long opportunity. So it starts in January and ends in the following December. So in that period, the youth delegate attends both the World Health Assembly, which is the governing body for the World Health Organization in Geneva, as well as the Pan American Health Organization Directing Council, which is the governing body for the Pan American Health Organization and the regional office of the Americas for the WHO. I realize I'm throwing so many words out there right now and they might not mean a lot to everybody, but yeah, that's essentially how that role works. And then, yeah, I guess how I got to where I am now. When I first started in my position as the youth delegate, I think it really opened the door to me to this whole world of engaging in health policy that I never really knew I could be a part of because, at the time I was only 25 years old. And it seemed completely out of the option to do anything related to the World Health Organization, which of course I know now is not the reality. So I think my strategy for kind of moving forward with this, when I realized it was something I was so passionate about, was really looking at what was missing and how I could help fill that gap. So Canada, while we're really ahead in the whole youth inclusion area, there's still a lot missing from the role that youth can play in government decision-making and policy work. So I actually proposed to my supervisors at the Public Health Agency of Canada that they should put together a permanent youth advisory board for both national and international consultation. They really liked the idea and hired me on as a policy analyst and to start putting that board together. So yeah, I think the message from that is to just always look for ways that you can help make something better or make something more efficient or fill a gap, because that's what I did in this role and it really worked out. Yeah, and then I think I answered every part of your question. But yeah, so now at the Public Health Agency of Canada, we're starting on some youth engagement strategies. One happened this March at the Canadian Stakeholder and Partner Forum for the Pandemic Instrument, which is a policy item that the WHO is currently working on. And I was actually able to bring in several Canadian youth to be a part of that forum, which was very originally closed off, very internal to the stakeholders that the government already had going. So I'd like to say, if anyone in this audience or even on the panel is interested in hearing about youth engagement opportunities for the Public Health Agency of Canada, they can send me an email. I don't know if my email is on the slides or anything, but I can put it in the chat. Send me an email and I'll add you to my email list. And that way you can access more opportunities like that in the future. Sorry, that was a really long-winded answer, but I hope it helped clarify some things.
Shiva, I know you typed it up, but would you like to also verbally share it with our panelists and our attendees?
Sure. It was just a small comment, just going off of what Bree said. I think I remember when I was, in my early 20s and when I was much younger, thinking about, well, I'm so young, what can I possibly have to contribute to these global challenges or to these discussions? And I think over the last several years, what I've noticed is that, in fact, the fact that you are young, the fact that you can see things in a very different way is a great thing. It's what we need. A lot of the times, a lot of the challenges that we're dealing with have, tons of bureaucracy, tons of institutional memory that have been put in place. And sometimes that's a good thing, but sometimes that's not necessarily a good thing. And so that's what I think, where you can come in and swoop in and say, here are new ways of handling this problem or new innovative ways of looking at this particular challenge, kind of like what Bree did. And I think there's a lot of strength and power in that. So I would really encourage all of you, do not let yourself be the limiting factor. Just you're young, you're a student, but take that as an advantage and leverage it to enter these spaces and contribute, because you absolutely have the expertise and you absolutely have important insights to contribute.
Amazing. Thank you so much for sharing.
Yeah, I think I might want to jump in and just express my gratitude for what has been said already. I'm so excited. Number one, failure. If you haven't failed, you're doing it wrong. And I think that's the truth that I've been living for the past 10 years. But one thing about me is that when I was trying to get engaged in global health, something that I've always had trouble with is, sometimes things don't resonate with me. I'm not in touch with a certain mission, or I'm not in touch with a certain nonprofit and so forth. One thing that I think that young people here everyone should know about is the need to create your own path. I really like that. If there's a challenge that you see is out there, go find people that are like-minded and find collaboration, find mentors, and address it. So during the pandemic, this is a great example. So during the pandemic, there was lots of misinformation in Kenya. So we learned about that, and myself, I was frustrated, and I'm like, we got to do something about this. So that was a challenge that I saw. And then, on my WhatsApp, on my little Instagram account, I messaged two friends that I know from Kenya, and we did, a little chat, and we kind of just spoke informally at how frustrating the circumstances are. One thing led to another. One person said, how about we write a proposal grant to our university asking for money? We did that. We got the funding. We got about $2,000 funding, which is not that much. But then we engaged with, the Public Health Service of Kenya. So for some reason, one of my friends had a connection there through a past, experience employment there. And then one led to another. We got to collaborate with the Public Health Service in Kenya. And then next thing you know it, we were sending, messages about COVID-19 to 18,000 people in Kenya on a weekly basis, providing accurate information and addressing misinformation. And all of this led from a group of 3 people on WhatsApp and Instagram just complaining about how frustrating it is right now. And one person coming up with the idea that, let's do something about it. Let's pitch an idea. If we were scared about failure at any of those stages, we would not have achieved what we achieved during that period, because all these things just seem so far-fetched to do a proposal, to get money for it, and to engage with the public health of Kenya. Like, that's just bizarre. But if there's anything I learned from that experience is, number one, you can't be scared of failure. If you're not failing, you're not doing it right. But number two, create your own opportunities by, engaging yourself with issues that you are most passionate about. You're going to do amazing when you are addressing issues that you are most passionate about.
Absolutely. Thank you so much for sharing about that. And that's actually the more you talk to me, the greater stories we get. It's actually so interesting. We do have a few more minutes left. If anyone has any other messages or questions, inquiries they want to throw in the chat for our speakers, because their time is precious. So this is the time to do so. And we did have a question that was sent through our social medias, and I know a few of you have already mentioned a bit about this, but let me just paste this also into the chat. We had a question about what role does technology play in advancing global health initiatives, and how have you utilized technology in your work? So I know a few of you already have that in your introduction, but I think it's important to share that as well.
I'm just going to make a brief comment on this because I think technology has a huge role to play, and a lot of it depends on what we're talking about. But there's this isn't work I did, but work I've seen and was very impressed by was a notion of vaccination in developing countries, which part of the issue with that is infrastructure. And what this one researcher did is developed a patch that actually had about 1,000 mini sort of needles on it. And you basically just slapped it on someone's arm. And if it was a child, you cut it in half and you gave them half of one. And the beauty of something like this is, like I said, there's not infrastructure. So you can do the train the trainer program, get people in the community, explain them how it works, and how you do this for the kid and you do this for the adult. And all of a sudden, a lot of the limitations within that society, not enough healthcare professionals, those sorts of things, or hospitals, or any of those sort of infrastructure issues kind of melt away. And so he had very good success. I don't know the size of that success, but the notion that they use technology and a different way to approach this in order to make very important vaccines easily available in a community, even if they didn't have sufficient numbers of health professionals. So I think we're going to see more and more of this sort of technology, whether it's blood work. I mean, we know Theranos didn't work out, but if it had worked out, that kind of technology would have made a big difference, because diagnosis often is through blood work. And if you don't have good systems to do blood work, you don't know what you're dealing with. So technology is, I think opportunities in technology are going to continue to happen. And one of the areas for me, I find, particularly in global health, particularly in developing countries, is diagnostics. We still need some much better diagnostics to find diseases, identify them earlier, and intervene earlier to prevent the more complex diseases that will happen downstream. And so technology is going to give us that answer. And I think we're going to see a lot of changes in diagnostics over the next 10 or 15 years.
If I could just add something that's not directly answering this question, but is related to it in a broader sense, and also maybe related to what Pratima just put in the chat. I think something we haven't touched on yet during the panel is, in global health, interrogating our own role and the role that we play as people coming from the outside, if that's the case. Often it is the case that we're people coming from the outside and entering a different community that's not the community that we grew up in or call our own. And, really being conscious of that, and conscious of, not to say that there isn't a place for us just because we're not from that community, but making sure that everything that we do with humility, and that we do in partnership with local communities with that spirit of wanting to learn and wanting to prioritize what the local community is prioritizing rather than what we ourselves are interested in. And I think, and technology can be fantastic. And And, of course, there are wonderful ways to apply technology to global health issues. I think sometimes in global health and in any kind of, actually, not just global health, but in many, many sectors and areas of work, sometimes we get caught up in technocratic solutions. We get really enamored with, oh, this idea is so cool. And we just want to go in and we want to implement it without really doing that hard work of really building trust, finding out if this is even an issue that people care about in that local community, finding out if this really cool solution would work, would be feasible in, the minute you leave. And I think what I have realized after working for many years in this field is that no one teaches you how to do that. There's no class or course you can take in your master's degree or your PhD to learn how to do that. You can learn all your methods and, all of the substantive stuff, but no one teaches you how to work with local communities. And that, I think, is core to any work anywhere in the world, and particularly when you're working in communities in the global South who tend to have less power than you do. So I would just leave you with that.
And I'm going to make one last comment. Sorry, I know we're running over time now. It's interesting about global health. We talk about global health, but even if you look at Canada, in a way, we are kind of a global health environment. In Canada, the Indigenous population has significant disadvantages. And we know about these. And in many ways, looking at the Indigenous populations looks very much like developing countries. And so there's lots of work that can be done, may not be quite as, well received necessarily, but there's lots of value in work being done within our own boundaries in some of those communities that are, have all the classic characteristics, no running water, no proper nutrition, et cetera, that you would see in a lot of developing countries. So it's funny, we want to think bigger when we think global health, but sometimes there's lots and lots that can still be done in our own borders. So I just thought I'd throw that in there.
Absolutely. Thank you all so much for sharing that. And that really reminds me of, the fact that so many communities we go into, we need to perform needs assessments, and not just what we perceive to be the needs of the community, but what the community actually wants and how to make sustainable solutions. And so, because out of respect for everyone's time, we do have one more slide left to share. And it's just we want to first of all thank all of our speakers and panelists for coming to our event. I think there's so much takeaway that we can absorb from this. And honestly, to be fair, I was taking notes on the side about what everyone has said thus far, because I don't think I can just watch it again. I think I need to write down all of the amazing advice and stories you've shared. Regarding Global Health Annual Review, we also, along the same lines that Dr. Sim has talked about, we want to talk about knowledge translation in our next event, which is going to be on June 12th. It's going to be a lunch and learn, so it's midday for Toronto time zones. And if any of you joining us are in any of the time zones before us, hopefully that does accommodate your schedule a little more. But part of this is talking about knowledge translation and how we, as researchers and academics in the field, can make our work more accessible to fit communities and to help humanitarian workers that work on the ground to make sure that this knowledge sharing that we have within academia is accessible to the rest of the world and not just gatekept within a very specific community. So if you're interested in learning about that, we are featuring Evidence Aid, which is a nonprofit NGO that spearheads evidence-based decision making for health policy makers as well as decision makers around the world. At the end, I know we still have so many questions that went unanswered because we are short on time, but if any of our speakers or panelists feel comfortable, you can let our attendees know in the chat or verbally if they can reach you or how they can best reach you to learn more about your work, your experiences, and to follow up on any questions that they might have. Thank you, Bree. I see you've already thrown in your LinkedIn and your email in the chat earlier on. But yeah, we thank everyone. And again, hopefully everyone has an amazing evening, afternoon, morning, wherever you're calling in from. And if you wait a few more seconds, some of our speakers are still typing in their contact info into the chat.